months before the world shut down for the COVID-19 pandemic, I was diagnosed with rheumatoid arthritis and Sjogren's syndrome. And navigating two life-changing conditions during such an uncertain time was overwhelming. What made it even more eye-opening was discovering how much autoimmune diseases disproportionately affect Black women and how systemic barriers delay our diagnosis. For me, the privilege of a routine eye exam covered by my insurance led to my diagnosis. But what about those who don't have the same access? Hi, my name is Nisha Campbell, and I'm the founder of Enhance Black Women's Health. And today we're going to dive into how Black women can manage chronic diseases in uncertain times. With ongoing changes to our healthcare system, no simple cure for autoimmune diseases, self-advocacy is more critical than ever. So we're going to discuss what autoimmune diseases are, the unique challenges Black women face, and strategies to help you thrive. So stay with me because at the end, I'll share one bonus strategy that has been a game changer for my own journey. Now, what are autoimmune diseases? Autoimmune diseases really occur when the immune system attacks healthy cells, mistaking them for harmful invaders. Conditions like lupus, RA, and multiple sclerosis disproportionately impact Black women. And health disparities, delayed diagnosis, and limited access to care often exacerbate these conditions. But the good news is, with the right strategies, you can take control of your health and improve your quality of life. So that's why I want to share 3 key strategies that made a difference for me. Number 1, advocate for yourself in medical settings. Years before my diagnosis, I experienced mysterious food intolerances and sensitivities. And when I asked my general practitioner for allergen tests, she dismissed me saying, just avoid these foods. Okay, that's not helpful. So still, I insisted on a test. And although the results came back negative, they weren't the end of the story and honestly shouldn't have been. Now I know that food intolerances can signal an autoimmune condition, and I wish I had pushed for more testing and deeper investigations. But here's what I want you to take away. If your doctor dismisses your concerns, advocate for yourself. You get to push for the treatments and a test that you need, and if your current healthcare team isn't being supportive, find a new one. Your health deserves nothing less. 2, integrate medical and holistic approaches. When I was first diagnosed, my doctors prescribed steroids and medication, and while these treatments helped, they didn't completely resolve my symptoms. And that's when I began researching and incorporating the autoimmune protocol diet, which focuses more on reducing inflammation through tailored nutrition and lifestyle change. And to my doctor's surprise, my condition improved dramatically when I started incorporating AIP. Now, over time, I was able to taper off the medication and focus on maintaining a modified version of AIP that worked for me. But this journey really taught me that you don't have to choose between medical and holistic approaches. A balanced combination of both can really yield the best results. So work with your healthcare team to explore options and make sure that you're making informed decisions. And number 3, find your community. Living with an autoimmune disease can feel very isolating, but it doesn't have to be. During the pandemic, I found solace in online communities and on platforms like Facebook and Clubhouse. Now, these spaces allowed me to really connect with others, share my struggles and celebrate those wins. Now, today I'm part of local support groups in Boston and have seen others create new communities to meet their needs. But essentially, finding a support network, whether it's online or in person, is essential. So if you can't find one, consider starting your own. You might be surprised by how many others are seeking the exact same connection. And then the last strategy I want to share is investing in group coaching or one-on-one coaching. I found it to be the most effective strategy for managing autoimmune diseases. Group coaching really helps you connect with people who have similar journeys, and it offers motivation and shared experiences. And on the other hand, one-on-one coaching really does provide you with more tailored support, and a coach can guide you step by step, help you navigate any roadblocks and really keep you accountable. So this combination of support and strategy can be really transformative while navigating an autoimmune disease. So if you take one thing away from me today, let it be this: your health is worth fighting for. Advocate for yourself, explore medical and holistic options, and find or create a community that will support you. If this resonates with you, subscribe to the Enhance Black Women's Health channel. Here we provide actionable strategies, uplifting stories, and expert insights to help Black women thrive in their health journeys. So make sure you click subscribe now and let's navigate this journey together.